Well, I think we can get started. And as folks are coming into the webinar, I'll just go through a couple of housekeeping items, give folks a chance to join. My name is John Turk, and I'm one of the directors here at Fiduciary Pension Partners. And thank you for all taking time out of your day to learn more about healthcare savings accounts. Given that we're in the kind of the thick of open enrollment, we thought that this would be a very opportune time to do an educational seminar about this. We will be recording today's session, and as a follow-up, we will be sending all of the attendees a copy of that recording. We'll probably go for about maybe 35 minutes. We do have the chat box open, so if you want to ask any questions, feel free to do so. And of course, we'll leave maybe 10 or minutes so for the ending. And just a quick commercial on Fiduciary Pension Partners, who we are. As I mentioned, for myself, John Turk, I've got, 30 years of experience in the retirement plan business, and I've got the gray hairs to prove it. At Fiduciary Pension Partners, we are a full service RIA shop, registered investment advisory shop, and we currently work with maybe about 120 clients and have just under 2 billion in assets under care and management. Up here, you can see some of the core services that we offer around retirement plan design, investment analysis, vendor management, employee education, doing sessions like this. So that's kind of the quick on Fiduciary Pension Partners. I am joined today by a great friend and our business partner, Mandy Banyai, who comes to us from Empower. And Mandy is very involved in the consumer-directed healthcare markets at Empower, and kind of that inflection point or convergence between where health meets wealth, if you will. And Mandy is passionate about helping organizations unlock value around their benefits program, specifically those consumer-directed healthcare plans. And just a little bit up on Empower, and you can see, for those of you that don't know, they are a large retirement plan servicer or record keeper, working with 88,000 plans across the country. And that includes over 19 million individual customers and participants. So why don't we take a step and get into the meat of the conversation while you're all here, right? And so if you think about health savings accounts, Mandy, maybe you could help myself as well as the audience understand, what's the evolution of these things and how they got started.
Absolutely. It'd be my pleasure. And thank you all for having me and spending a little more time getting familiar with HSAs today. As John said, please ask questions along the way. We'll try to answer throughout the presentation as well as at the end. So without further ado, let's talk about where this started. So December 2003, the act was signed for HSAs to be put into place January 1st, 2024. So these accounts have been around for over 10 years, and they were designed to help individuals save and pay for qualified medical expenses with pre-tax dollars. When we talk about pre-tax dollars, this is a great opportunity for employees to use these accounts for tax savings. So when you think about federal income tax, applicable state taxes, your FICA payroll taxes, all of the money that you put inside your HSA is exclusive of those tax. And what that really means is potentially on average a 30% savings for you, which means you're stretching your dollars further and you're able to cover more medical expenses by using these accounts. These accounts are typically paired with a high deductible health plan. What that means is that you or whoever your health plan primary provider is signed up for a high deductible health plan. That's how you're able to sign up for an HSA. And HSAs are really intended to give you control so that you can manage your spending and really take full control over your healthcare costs, right? It's your own money, it's your own dollars, shopping around for providers, for services, for prescriptions, even. Making sure that you can maximize your dollars is really the intent here. And when we look at HSAs in general and how they've come into the market, we're seeing that every year they grow. More and more accounts are happening in the market. Devenir, who's a leader in the market, predicts that we'll have over 47 million accounts with $208 billion in assets by 2027. So not only was this put into place over 10 years ago, but it's really taken off, and we're seeing more and more people adopting and looking forward to using their HSAs.
And that's great information. And certainly we've all seen tremendous growth in this marketplace. But when it kind of comes down to the nitty gritty of it, what is an HSA? You mentioned the tax advantage and utilizing it or combining it with a high deductible health plan. But what does that really look like?
Yeah, absolutely. We'll get into more details here. So in being paired with the high deductible health plan, right, you're able to get enrolled in your HSA. Sometimes your employer will actually contribute some funds into the HSA to help get you started. But one of the things that's really key here, the second bullet, this isn't a use it or lose it account. So for those of you that might be familiar with flexible spending accounts that have been around much longer than HSAs, that's money where if you put it into the account, it's set and earmarked for medical expenses, similarly to HSAs, but you only have access to the funds for that medical plan year. If you don't use the funds in that account in the FSA, you lose it. The HSA, that's not the case. The funds roll over year after year. So you're never faced with that use it or lose it that you might be familiar with from the FSA. One of the other great things, not only does it roll over year to year and you keep all your funds, but it's portable. What does that mean? You change jobs, you take your HSA with you. Really similar to the 401k in the retirement world, right? You're able to roll it over and take it with you. There's flexible contributions. So if you're going through open enrollment right now, or maybe you started a job recently as a new hire and you had to dictate how much money am I going to set aside in my HSA, it's something you can, start, set it and forget it. But if you ever need to make changes, whether that's you want to contribute more or contribute less, anytime throughout the year, you can make those adjustments. Again, similar to the retirement side, you can change those contributions. Potential investment. So this is really interesting and something that's very specialized for the HSA. You can actually invest your funds, meaning you can put the funds into the market, and any of the growth that happens in the market over time grows tax-free. Just really interesting. So triple tax advantage we'll talk about soon, but that's something really unique that occurs in the HSA, unlike, again, that flexible spending account. And then I mentioned this at the top, but again, employers many times will contribute to the HSA, which is free money for you to hopefully take advantage of.
Amanda, you mentioned the tax advantage, and maybe if you could go into some detail as to, why is it a 30% savings in an HSA?
Yeah, would love to. So let's drill down. When we talk about triple tax advantage of an HSA, it's one of the most powerful accounts in existence today. The funds, starting at the top, the pre-tax contributions, the money that you put in, like I mentioned, you're not paying income tax, federal tax, you're not paying state taxes if that's applicable to you, and you're also not paying the FICA payroll taxes on any of the dollars that you're putting into the HSA, which on average is about 30% savings in this account. The money also that you put in the market, as we talked about, if you would like to invest, all the growth that happens over time is tax-free, both interests and investments. So if you have money that sits in cash that builds interest, that's tax-free. Money in the market, invest, growth, tax-free. And then when you want to withdraw money from your HSA, as long as you're spending it on qualified medical expenses, which we'll talk about in a moment, it's tax-free. right? So triple tax advantaged account, that's where the three parts are coming from.
And Mandy, we had a question come in
Yeah.
prior that's somebody asked the question, well, today I have to, let's say I go to the doctor and I've got a $25 copay, right? And I'm paying that in cash. Can you speak to maybe why that is taxable and why the HSA is an advantage?
Yeah, yeah. So the reason that it's taxable, right, is there's a sales tax that's associated with that spend, whereas the HSA, if you do spend on, for instance, sunscreen, which is a qualified expense in the HSA, you're still going to pay a sales tax on it. But again, where you're getting the tax benefits is the contributions, the growth, and then the withdrawal itself.
Thank you. That's very helpful. And I will say too, for folks that have those out of pocket medical expenses, they might be tax deductible but they have to exceed a certain threshold. So it's just something to keep in mind. And if you are putting out of pocket for prescriptions or co-pays for doctor visits, make sure you save those receipts because at the end of the year they might be tax deductible. Um, now, it, my favorite candy is Reese's peanut butter cups, and if I go to a Walgreens or my pharmacy and pick up a pack and can I use my HSAs because I'm in a pharmacy? What's a qualified expense? What does that
Oh,
look like?
such a good question and great pick of candy. Hopefully you had your fill this past Halloween.
A little too much.
Um, even though you are at a pharmacy, that is not a qualified expense. So that should not be something that you use your HSA dollars for. If you want the full laundry list of all of the things that you can use an HSA for, we've linked the IRS website to the bottom of this page. So once you get this recording in this deck, you can click the link. But here's a few things that you can spend it on. Some of the common items, healthcare items, deductibles, prescriptions, true prescriptions, not just spending at a pharmacy, doctor's visits, glasses, contacts, hearing aid, LASIK, dental, of course. And then some of the things that people don't know, Band-Aids, feminine hygiene products, a lot of everyday use items you can spend your HSA dollars on.
Great information there. Thank you. And so we've had some recent legislation, right? The big bill was passed, and I know there was some positive impacts around HSAs. Maybe if you could speak to those and those positive impacts.
Yeah, yeah, and the big beautiful bill is a great thing, and the impact that it has on HSA. And really, I think I'll take a step back and just talk legislation in general. One of the things that we're currently talking about and trying to figure out, these accounts are so powerful, but again, we mentioned they needed to be paired with a high deductible health plan. There's a lot of conversation on whether or not HSAs should be made available to all, not just folks enrolled in a high deductible health plan, because we know medical expenses are some of the highest bills, especially as we go into retirement, that people are facing. And so, yes, there's a few components of the big, beautiful bill that have expanded what HSAs can be used for, which I highly recommend that you all look at the IRS guidelines and follow that. But I also think as we look at the future of HSAs and where they might be going, there's even more on the horizon. So it's a really good time, whether you're enrolled in an HSA now or thinking about enrolling, it's a really good time to consider. One other thing to know, and you can see on screen here, the contribution limits, similar to retirement, they actually increase annually. So every single year, you're going to get new contribution limits that are put out. You can see if I sign up and enroll in a high deductible health plan as an individual, my limit to put into my HSA for 2026 is going to be 4,400. If I sign up as a family under my medical plan, you can see that that's northwards of 8,700. But then also, a lot of people don't know there's a catch-up contribution that is applied to the HSA. So if you are 55 years or older, you can contribute an extra $1,000, whether you are in an individual or family plan.
And so just to clarify, how you file your income taxes doesn't determine that limit of individual or family. It's how you choose your healthcare coverage within that high deductible.
That's correct.
Great, great. And so you kind of touched on this a little bit. What happens if I don't use the money in the account? You mentioned there is portability. Maybe share some details around that because I think this is an important highlight and differentiator of HSAs.
Absolutely. So we mentioned any funds that you don't use in your HSA keep rolling over year to year. You're never losing them, right? Your invested funds continue to grow tax-free. And then at any time, you can pull down the money from your HSA on qualified on qualified medical expenses, and it'll be tax-free. But one trick, if you're able to, a lot of people, John, to your point earlier, are starting to save receipts. So if you can pay out of pocket for all of your medical expenses and just save your receipts, there's one interesting tactic where we call it the shoebox method, where maybe I can contribute as much as I can every year in my HSA. I can invest what I can and have it grow over potentially decades, saving all my receipts along the way. Once I retire, or once I'm in a position where I need to use those funds, I've got a shoebox of receipts. I can reimburse myself at any time from my HSA using those receipts. And so it's a really interesting way to use the HSA as a long-term vehicle and get as much market growth as you possibly can before you actually cash in on using your HSA for medical expenses. So, again, that's something really interesting, especially helpful knowing that the HSA is portable. Any of your job changes, you make sure you're rolling over that HSA. It is your money. So, think of it both as a short term, I can use it for medical expenses now, or I can really think about it strategically long term for funds into my retirement.
That's great information because if you think about it too, if you're going to use it longer term, that might help change how you're investing those dollars more for that growth. Now, I am going to ask a question here, and it's partially for selfish reasons coming up. If I'm older than age 65 and I have a
Mhm.
Medicare policy or premiums around those policies, can these dollars be used to pay for those or as some type of a reimbursement?
Yeah, so Medicare and HSAs get tricky. You can't be on a Medicare medical plan
Okay.
and have an HS and keep contributing to your HSA. You
Okay.
can still use your HSA for the applicable medical expenses that the IRS deems are
Okay.
expenses that you can have, but Medicare and HSAs do not go together.
Good information, and thank you for sharing that, and
Yeah,
appreciate that. And I apologize, little 3 for 1 there, a little
no
curveball.
problem.
So we know Empower, right? A lot of folks think of Empower from a 401k or 403b on the retirement side. Talk to us about Empower in in the HSA market and some of the differentiators that they're able to bring to the bring to both employers and their employees.
Yeah, you talked about it at the top. It's really the idea of bringing for employees together both the retirement and the healthcare side of the puzzle, right? Because we are all whole people. We have to be thinking about both. And so bringing the funds that you have for health and wealth together into one spot to let you know how you're doing, especially in the case of the HSA, where we've just mentioned it can be used for short term, but it can also be strategically used for a long term and as a retirement vehicle. And so, what we do here at Empower is we give people the access and the resources they need to see both together. How are their retirement accounts doing? How's their HSA doing? How does that combine to their total net worth and their overall retirement readiness? Having both sides of the picture really matters and is going to help make help employees make better financial, not even employees, people, going to help people make better financial decisions when they've got all of the funds in one spot and are able to see them and strategically decide what should I do next? Where's my next best dollar go? Or maybe where's my next best dollar spent?
And we can see too from the statistics how it helps drive participation, helps drive engagement. And we know when folks are in retirement, um, healthcare is a big portion of that overall expense budget. So this is great information and a great way to help folks with manage those day-to-day expenses. Now,
Absolutely.
in terms of accessing the HSAs, one thing that really drew my attention on this slide was a debit card access, right? That sounds so easy and convenient. Maybe speak to that a little bit.
Absolutely. So one of the things that we at Empower offer, as well as many of the HSA providers, is you're going to get a debit card when you open your HSA account, and it's going to be connected to those funds. And so if you have anything that you need to spend your HSA dollars on, you should be able to swipe the card and it goes through. So you get instant access to your funds. The other way to do it, if you, oh, forgot my wallet, forgot my HSA card, totally fine, pay out of pocket, keep your receipt, and then you just request reimbursement out of your HSA so that you are made whole. So our real goal here is we realize some people have really high medical expenses or costs and they need to use their HSA on a daily, monthly, whatever it is basis. And so making access to your funds easy to understand, easy to gain. But should you happen to be on the other side and again want to tuck those funds away, try to save as much as you can, invest as much as you can, we've built the experience for that kind of person too, so that this HSA can be dynamic and you can use it however you need to.
And that's great having those different methods to access the dollars when you need it. And it's really a nice, convenient feature. So if you do have any other questions about this, you can direct those to us at Fiduciary Pension Partners. And we've got the email, which is info@fiduciarypp.com, or drop us a call at 908-224-2377. We also have a very robust YouTube channel, which hosts and holds a lot of webinars and seminars such as this. We've got one on budgeting, one on Medicare that we get a lot of positive feedback on. And so we would encourage folks to visit that and take advantage of those videos that are there. Um, we will be following up with a recording of this session to all of those who have attended, along with a brief survey. And in addition, we are also hosting another webinar. All right, we've got kids home from college and second semester tuition payments due. So next week on November 20th, we are hosting a webinar with another partner on 529 college savings plans. And again, you've had some recent legislation as part of that big bill that enhanced those plans. So that is next. It's a week from tomorrow. The week from, yes, November 20th, Thursday. So be on the lookout for that invitation. Well, let me say thank you to you, Mandy, and the team at Empower. You've been great partners of ours throughout the years, and I appreciate you sharing. I know I learned a lot today, so it was a great session for me, and I hope for our audience that they found it beneficial, helpful, and you certainly given some great strategies and tactics that they can take away and hopefully utilize in that convergence of health and wealth in their own lives. So thank you to the Empower team for all of your support on this.
Thanks for having us. It's been fun.
So why don't we kind of call it a wrap then, right? Again, great session, Mandy, and thank you to the the behind the scenes folks at Fiduciary Pension Partners for keeping us honest from a technical standpoint and all of the kind of the cast and the crew. We want to recognize the crew here for all of their help. And then lastly, a thank you to the audience again for taking time out of your day to learn with us, hopefully grow with us, and hopefully we have provided you with information that you can utilize in your day to day. And like I said, kind of help with that convergence of both health and wealth. So thank you everybody for your time and have a great rest of your day.